On behalf of the Elon University Department of Physician Assistant Studies faculty and staff, welcome to our Elon University Class of 2017 White Coat Ceremony today, and I think that deserves a round of applause. Probably a lot more of that coming too. So in addition to the students who've been counting down the days until today, we're pleased to welcome family, friends, faculty, and staff as we gather to celebrate this special occasion. We're also honored to have our Provost and Executive Vice President Stephen House, Associate Provost Tim Peoples, the Reverend Dr. Jan Fuller, who graciously allowed us to use this beautiful space, and our wonderful colleagues from across campus, including graduate admissions and library services joining us today. Without all of your support, this wouldn't be possible to have this landmark celebration today. And as always, I don't know if she's in the room or not, but I want to have a special note for Miss Lynn Wentz, who puts in incredible hours trying to make this a perfect event for you. There she is. I also just want to say we are so grateful that our colleague, Ms. Nita Skillman, is here with us today. She's such an important part of our program and our School of Health Sciences, and I know the students would really feel something was missing if she wasn't here today. So Nita, thank you for being here with us. The White Coat Ceremony marks the transition of academic medicine to one of clinical practice. It reminds us that medicine is practiced most effectively when it's dispensed with compassion, humility, and the gift of healing. It also reminds us of preparing those who come behind us for care of our patients, care of their families, and care for themselves, so that they can always be at their very best when it's needed most. It's a gift as well as a responsibility. Today's a time for our students to celebrate the accomplishment of successfully completing a very demanding academic year. And if you haven't already heard about it, I'm sure you'll get to. So we welcome all of you here today, knowing that each of you have played a very integral role in making this day possible for the Elon University Class of 2017. At this time, I'd like to introduce Dr. Stephen House, Provost and Executive Vice President of Elon University, who's an enthusiastic supporter of the PA program. He joins us today to celebrate this important milestone, and he's been here every year. So please join me in welcoming Provost House.
Thank you. Good afternoon. On behalf of the university and the president, I also want to welcome you to the White Coat Ceremony. To the students, when I welcomed you at the PA orientation in January, I described the Elon community that you were joining. I told you that Elon is like no other institution in the country, and we like that. I told you that Elon is widely recognized as a university that is the preeminent institution for experiential and engaged learning. Finally, I told you that Elon was going to make a commitment to each one of you, a commitment to provide a distinctive, exceptional educational experience, an education that will transform each of you into outstanding professionals, ready to serve others with a respect for human difference, a devotion to personal and professional integrity, and an ethic of work and service. As you've already heard, this White Coat Ceremony is a rite of passage, welcoming you to the next phase in your journey of becoming physician assistants. The white coat itself symbolizes the clinical service and patient care. By accepting a white coat, you are making a commitment to transform yourself into a healthcare professional in whom patients place their trust. One of the most renowned and revered members of the healthcare profession is Sir William Osler, one of the 4 founding members of Johns Hopkins Hospital. We are all in his debt. Before Osler, students learned to become healthcare providers by attending lectures and studying specimens in jars, and then graduating, and then being an apprentice for a short while. Osler knew that healthcare professionals needed to learn medicine at the bedside, not the specimen jar. And so he put students in clinical rotations. He knew that patients are the best teachers. Osler also asserted that the practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised as much as your head. Another name you need to know is Eugene Stead, a faculty member at Duke and one of the founding members of the physician assistant profession. Dr. Stead's legacy can be summarized in the following. He regarded people as the primary product of an educational institution, and his highest priority as a teacher was to help people learn about medicine, learn how to learn about themselves, and learn about others. Dr. Stead also taught that to care for the patient, you must care about the patient. So it is in this spirit of Dr. Stead and in the spirit of Elon's commitment to you, to transform you, that I wish you all the very best as you begin the journey of caring for and about patients. Congratulations.
Thank you. At this time, it's my pleasure to introduce Dr. Tim Oakes, who was selected by the students to give the keynote address today. Dr. Oakes is a graduate of Pennsylvania State University School of Medicine, and he subsequently completed his internship, general surgery, and cardiothoracic surgery residency there. He is associated with Wake Forest School of Medicine and practiced cardiovascular surgery in North Carolina Baptist Hospital for many years before joining the Ely surgical practice here in the Burlington area. And we're so glad that he did. It wasn't long before he heard about the PA program and he expressed his interest in teaching students here at Elon, PA. On top of his busy clinical schedule, he's been very active in both the academic and clinical phases of our curriculum. He not only provides lectures and works in the human donor lab, but he's also teaching you skills. Imagine how surprised I was that people knew how to do one-handed ties before I taught them. I said, who taught you this? He also finds time to precept our clinical year students. Our students in both years appreciate his dedication to their learning that reaches across both years and the really high standards he sets for them. His dedication to the program was recognized by the honorary membership in Pi Alpha, the PA Honor Society, at our class of 2015 graduation earlier this year. So at this time, please join me in welcoming Dr. Tim Oakes, who will share his insights with the students on making this important transition with his presentation entitled, What's in Your Wallet?
Thank you very much. Y'all ready? All right. Well, good afternoon and welcome, Provost House, Dr. Reagan, faculty, parents, families, and friends. I welcome you here today as we celebrate a milestone for this class, the class of 2017, which is the presentation of the white coat, which you see over here. This marks the transition from basic science education to clinical education. I know how hard you all have worked. I've been there with you, and I know that you're ready. So let's have a round of applause again for this class. And I want to say thank you very much for the very thoughtful present. What an honor to be asked to give this address, particularly after you endured my last 4-hour-long lecture marathon on surgery and wound healing. I promise that I'll make this talk mercifully short compared to that one, but unfortunately it's not going to be any better, so that's not funny. Okay, a year ago, my daughter passed her driving test. And the first call I made was to my insurance company, of course. But the second call I made was to the Automobile Association of America, better known as AAA. See, when I was a teenager and a young adult, you had to have one of these cards if you were going to do any traveling. And I was proud to be a member of AAA. So when I gave my daughter her AAA card, she said, "Dad, what's this?" I said to her, well, it's a great card and it can do lots of good things. See, if you just give them a few days, they can prepare for you a triptych, which is a large paper folder which will provide you with all the directions to where you want to go. And she looked at me and she said, "But Dad, I have Siri for that." And I said, "Well, AAA can also provide you maps of every state in the United States." And she said, "Dad, Google Earth does all that and so much more." So finally, feeling somewhat defensive, I said, "Well, AAA will also make hotel reservations for you." And she said, "Well, there's a website called Trivago which will do that, Dad. Give you thousands of hotel room prices instantly and even give you online reviews." So I felt somewhat dejected and deflated, and I left my card on the table and I walked away. So I ask you, class of 2017, do you have a AAA card? What's in your wallet? Well, I suspect that none of you, or very few of you, actually have a AAA card. But don't despair, because today I'm going to give you your very own, unique, special AAA card. See, this card is not from the Automobile Association of America, but it's from me, and it's my gift to you. You can use this card anytime and any place. You can use it at work or at home. You can use it every day, and in fact, you should use it every day. It never expires and never has an annual fee. So, let me tell you what these many virtues of this card stand for. The first A on your AAA card stands for able. Webster's defines able as having sufficient power, skill, or resources to accomplish a task, or as being marked with intelligence, knowledge, skill, or competence. Now that's an easy one for this class. You're all intelligent. You have huge amounts of knowledge at your fingertips, and you've worked very hard over the last year to prepare yourself for your clinical rotations. You have studied pharmacology, physiology, pathology, and every other ology that there is. You are ready. You are well prepared. But no one knows it all. Not your professors, sorry. Not your supervising physicians. The human body is the most complex thing in the entire universe, and it's impossible for anyone to understand all of it. But that doesn't mean that you shouldn't try. You should recognize the importance of education and strive to learn all that you can and apply it daily for the benefit of your patients. Your patients are seeking competence, and you should provide that. You should come to work each day fully prepared for the many challenges that day may hold, because patient care demands your undivided attention. You should make every effort to practice within your sphere of knowledge and make sound decisions. But being competent requires more than just medical education. You must also be part biller, part coder, part social worker, lawyer, counselor, hospital administrator. You need to understand that our definition of the practice of medicine is somewhat different than other professionals who participate in the patient's care. All of these are important. So, as you can see, being able may not be quite so easy after all. Notice also that the definition of able does not say that you must accomplish this task alone. Being able may also mean having the knowledge to know when to seek help or when to delegate certain aspects of patient care to someone else. It's recognizing one's own limitations. Therefore, it's equally important to know what you don't know and to seek assistance when necessary. Someone's life may be on the line. Asking for help from a colleague is not a sin, it's not a weakness. Rather, it's a sign of maturity and commitment to your patient's welfare. Never let pride or arrogance stand between you and your request for help. Remember that being able also refers not just to a point in time, but rather to a continuum that's going to last your entire lifetime. You must stay abreast with the current literature, read the journals, know the best practices and guidelines, and attend your specialties meetings. Yes, it's a daunting task to try to stay current with the ever-expanding knowledge and understanding of human pathology. It can be frustrating and seems sometimes hopeless. No one expects you to have every answer, but again, that doesn't mean you shouldn't try. One of my professors used to say, "Oaks, every day is a school day," meaning that every day you should try to advance your skills, learn, and increase your knowledge. You have chosen a profession in which there are no teacher work days, there are no federal holidays, there are no spring breaks. No, for you, every day is a school day for the rest of your life. The second A on your very special AAA card stands for affable, which Webster's defines as being pleasant and at ease when dealing with others. We may also use words such as gracious, cordial, sociable, or genial to describe someone who is affable. It seems rather self-evident that being affable would be a desirous trait, but many healthcare providers fall far short of being personable. Patients want a provider to be honest, concerned, and friendly. And patient satisfaction is frequently based upon their perception of the healthcare provider's affability and not their competence. Now, although that may be reassuring to some, wouldn't it be better to be both competent and gracious at the same time? I would prefer that. Most of the time, our interactions with patients is pretty routine, with both the patient and the provider acting in a jovial yet professional manner. But occasionally the demands of the patient may tax even the most affable of providers. In these circumstances, it's important to recognize the source of the patient's frustrations and to remember the golden rule. Always treat others as you would want yourself to be treated. Put yourself in your patient's position and try to rectify any problems that are under your control. Patients with serious healthcare issues are scared. They're scared of the diagnosis, they're scared of the treatment, and they're scared for their families. They are desperate for a caring touch, an understanding smile, and a warm heart. They need to feel that you care about them as a person and not just a disease process. They need you to understand their unique social and familial needs, and they cherish the healthcare provider who will be empathetic. Pain and suffering, death and dying are all a part of life, and we as healthcare providers are unique in being privileged to participate in these events. We have the opportunity to comfort the suffering, encourage the sick, and provide emotional and spiritual support when needed. This is all included in the definition of affable. Is this emotionally draining? You bet it is. But the rewards are indescribable and they're beyond measure. Being affable to patients and families is a given, but this same character trait must be applied to all those we work with. Society has recognized your talents and gifts and has placed you in an elevated position within healthcare. But remember that every single person deserves your respect and professionalism. You are no better, no worse, just different. Your success depends upon all: the housekeeping staff, the hospital administrator, the CEO, the lab tech. All of them have a unique set of skills, and they should demand your respect. And always remember that you catch more flies with honey than with vinegar. To truly have a successful career in medicine requires us to be affable and even lovable to one other group of people, our friends and our families. Just like the old Mills Brothers song from 1944, "You always hurt the one you love," we find it easy to be short-tempered, unreasonable, and sometimes outright ugly to our friends and family. People who would never raise their voice to a nurse find it easy to yell at their spouse. People who would never belittle a laboratory technician do so easily with their children. We hold our patients' hand, comfort them, and provide spiritual support, but we bring our disappointments, our frustrations, and anger home with us, and we heap it upon those who care most for us. We're often demanding beyond reason with our spouse, our children, and our parents. We are ungracious to those who should matter most to us. Why? Well, I really don't know for sure, but my opinion is that we think our family will always be there for us, and that they'll excuse our behavior because, after all, they know the stress that we're under. There's no question that we have a hard task managing the needs of our patients and our family, and for some of us, the ultimate price we pay for our lack of affability may be lost friendships, estranged children, and failed marriages. We must recognize that our families are the foundation to our success, and we can never repay them for the sacrifices they have made and will continue to make for us. The third and final A on your AAA card stands for available. Simply stated, it means to be present and willing to talk to someone, or to be willing to assume responsibility for a task. You may be the most able and affable PA, but if you can't be found, or you're unwilling to take responsibility for a problem, you're not available. In its most basic form, available means devoting sufficient time to your profession to get the task done. That sounds pretty simple. It's easy to accomplish, right? Well, I can assure you that nothing is farther from the truth. After a busy day in the operating room, where do you find time to return all the patient calls, speak to family members, dictate charts, sign all the necessary forms, and do all the other necessary tasks throughout the day? Patients and families want your time, and they want it now. They're not pleased to wait till next Friday for the pathology results, and they're not going to wait 3 months for a referral to a neurologist. Like the Lady Antebellum song says, it's 1:15, I'm all alone, and I need you now. I knew you all would get that. Yes, the demands on your time are incessant, and they're frustrating. But the rewards you will experience when devoting time to your patients far outweigh your efforts. Calling a patient at 7 o'clock at night to tell them the biopsy was not cancerous may be the best part of your day, not to mention the patient's. Yet patients aren't the only ones asking for your availability. You'll be asked to serve on committees, give talks, volunteer at charitable clinics, and someday you may even be asked to speak at a white coat ceremony. When you enter this profession, you are acknowledging the many blessings that have been bestowed on you, and it's incumbent on you to give back to the community. That is your responsibility. And finally, what about the responsibility you have to your friends and family? There are never enough minutes in the day to spend with your parents, spouse, and children. There are never too many vacation days in the year to rekindle the love you have for your family. Finding a happy medium between devotion to family and devotion to work is difficult and sometimes seems impossible. That is why we must take every opportunity to show our gratitude to our parents, our children, and our spouses for their unconditional support. So finally, class of 2017, you will soon be called to receive your white coat, symbolizing your acceptance into the fraternity of healthcare providers. Your profession is demanding and difficult, yet it is the most satisfying in the world. In preparation for your clinical rotations, I'll ask you again, what's in your wallet? Will you carry your AAA card, able, affable, and available? Your AAA card is far more valuable than mine, as your card will serve as a pathway to success and a lifetime of fulfillment. Congratulations, class.
Thank you, Dr. Oakes, for those inspiring words. And I know I'm never going to look at my AAA card the same. Yes, I have one. Well, we've come to that really, really exciting time at the time when we're going to present the students with their white coats. So we're going to respectfully ask that everyone remain seated during this time. And I used to say, and we'll hold our applause till the end, but I think we should applaud as each one of them gets it. It's a pretty big deal. So I'll ask the faculty to come up here and we'll get things underway.
Alexander Axtell. Cassandra Bogdan. Lindsay Bradshaw. Alyssa Katie. Danielle Carter. Amanda Chaffel. Kayla Chekovich. Zach Dedden. Stephanie Dyke. Emery Edwards. Brandy Forbes. Jonathan Gross. Peter Gerton. Kim Heald. Ariel Hilsinger. Shayna Hornbeck. Caroline Howell. Bree Johnson. Elena Klaus. Rachel Lane. Elizabeth MacArthur. Ashton MacDonald. Whitney McVeigh. Ashley Meyer. Lisa Nichols. Mackenzie Pratt. Stephanie Puma. Amber Race. Aaron Raspet. Scotty Springer. Elizabeth Strickland. Nicole Tritshu. Boyd Vickers. Catherine Vornheder. Brittany Wiseman. Michelle Worley. Katie Young. And Michaela Zeltman. Okay, let's all give each other a round of applause. Next, Professor Tonsor will lead you in the oath.
Okay, your first task. If you'll all stand with me and we'll recite the professional oath. First of all, how does it feel? All right. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor. I think that deserves a round of applause. Okay, you can be seated, and now Lindsay Bradshaw, the class vice president, is going to come up and say a few words, and she'll be followed by Brittany Wiseman, the class president.
Feels so professional. So welcome. I would like to just take a second to not move this and to thank all of you for taking time out of your day to be here with us on this special day. So tonight is a night for celebration, but it is also a night for congratulations, and not just to the 38 students sitting before you. We wouldn't be here today if it wasn't for each and every one of you. To the faculty, congratulations. You have made it through 3 didactic years. You now have them under your belt, and I'm sure it feels amazing. I can't imagine how good it must feel, actually. Haven't been in those shoes. You have worked numerous hours to help turn each of us into the professionals who are prepared to go out into the field and represent Elon. And because that wasn't enough work, you have spent countless hours acting as our advisors and mentors. But you didn't stop there. You have gone above and beyond and become our family. You have rejoiced with us when we succeeded, and maybe when we didn't do so well. And you supported us on each of those times where we felt like we couldn't go on. Each of you has been our biggest enemy, but also our greatest advocate. So I say to each of you, congratulations, and thank you for helping us survive the ups and downs and twists and turns of this year. To the friends and family, congratulations. You too have just made it through this didactic year. We could never minimize the role you have played in our success. I think I speak for everyone when I say you have been our shoulder to cry on when we are overwhelmed, or maybe just because it was another day filled with ClinMed. You have been our ears to listen to us when we needed to vent about how absurd our expectations of us were, though we somehow rose to the occasion. and you have been our voice of reason when we were ready to quit, which was about every day during spring semester. So I say to each of you, congratulations and thank you. And finally, to my classmates, congratulations. We made it. We have survived 11 of the best and the worst months of our lives. I think everyone in this room knows that we've been through a lot, but let's just take a moment to look back on what we've encountered and what we've conquered. In the last 11 months, we have completed 86.5 credit hours. And if that's not crazy enough, we have taken 74 quizzes, 54 exams, 7 skills assessments, 9 standardized practicals with real patients, 7 papers, and 1 horrific pack rat. But somehow, with the help of those who are here with us today, and with the help of each other, we did it. We are now on our way to clinical rotations, where I know at times we will feel like fools, and we will probably make fools of ourselves, but we will also excel at times. So congratulations. It's time to show the world what we've learned.
Well, guys, after the many countdowns to white coat ceremony posted to our Facebook group, this day is finally here. I would like us all to take a moment and to think back to where we were 12 months ago. Most of us were worrying about being able to handle the workload and maintaining balance in our lives. Others were having difficulty with the concept of wearing business casual every day, or even knowing what business casual meant. Some were intimidated by making friends with our classmates, and a few of us were concerned with bigger things, like trying to plan a wedding during PA school. Now, look at where we are today. While Lindsay dazzled you with how smart and dedicated we are, here's a look at what we can accomplish during our seemingly non-existent downtime. We have 5 recent marriages and engagements, 2 new moms-to-be, 3 intramural championships, 30 custom-made knitted socks, thanks Bree, 460 hours volunteered, and 1,400 branches burned in a massive bonfire. Reminiscing on all that we have accomplished in such a short amount of time, there is no doubt that each of us should be extremely proud of ourselves. But we could not have done it without everyone in this room, or the ones down the hall in the room with it being live streamed. To our friends and family members, thank you for your unconditional support. Whether it was a phone call, one that we may or may not have time to answer, a text, a care package in the mail, a surprise visit, or a shoulder to cry on, we greatly appreciate you and all the encouragement you have been giving us throughout this year. Without you, we would not have maintained the sanity it takes to complete this rigorous program. To Dr. Reagan, thank you for being the most amazing and attentive program chair and reminding us that at the end of the day, the most important thing we learned this year, hands down, was doxycycline. To Dr. Bennett, thank you for being our PA motherly figure and for fascinating / slightly terrifying most of our class with all that goes into reproductive medicine. To Dr. Murphin, thank you for making supercalifragilisticexpialidocious look like an amateur word to all the medication names you taught us, most of which I can still not pronounce, like bevacizumab. To Dr. Duffy, thank you for your exceptional PowerPoint organizational skills. I hope you realize how much anxiety you reduce presenting the material the way that you do. To Professor Tonser, thank you for keeping us calm these past few weeks and for sharing your plethora of knowledge on cardiology with us. To Professor Moore, thank you for your passion towards your job and for teaching us hands-on skills like percussion, so that if we were ever stuck on an island without our medical bag, we could still be capable of finding a lung consolidation. To Professor Ramos, thank you for always being willing to go out of your way and help share practical knowledge with us. To Ms. Skillman, thank you for always reminding us to smile, knock, and enter before we go into a patient's room. To Ms. Wentz and Ms. Schrader, thank you for keeping us on top of, well, basically everything. And to all our other adjunct professors and guest lecturers, thank you for the breadth of knowledge each of you have collaboratively attempted to cram into our tiny heads over the past year. And lastly, to my fellow classmates, thank you for making this year one that we will never forget. We have sat through countless hours of class together, studied together, tested together, laughed together, heard the word diabetes almost every single day together, and collectively consumed about 20 dozen boxes of donuts together. I know most of us have heard or used the term "my person," which defines that one individual in class we could not have survived this year without. But I just want all 37 of you to know that I consider you guys my people, and will be forever grateful for each and every one of you. Without you, this year would not have just been unbearable, but boring, lonely, and unbearable. So thank you for being my people and for making our journey of #KnowAllTheThings a little bit more feasible and desirable, despite the fact that most of us may feel #we still don't know all the things. Thank you all, and congrats, we did it.
Well, congratulations again to the class of 217 for completing the first chapter of your PA education. Yes, there's more to look forward to. All of us look forward to hearing wonderful things about you as you enter the clinical phase in January. And know that as you have learned from us, we've also learned a lot from you. You exemplify the characteristics of compassion, tenacity, creative, giving, and have shown us much about what it does to go forward under any circumstances. We know that you'll do a great job in the care of patients and that you'll always be there when they need you the most. You've embraced the community and the patients at the Open Door Clinic with unmatched enthusiasm. We feel confident that you will be an advocate for and make a difference in the lives of the patients you encounter and the communities in which you live. It's an exciting time to see you move on to the next phase. This concludes our ceremony. In just a moment, I'll ask the class of 217 to stand and file out into the hall where they'll assemble for their class white coat photo. Once our caterers have finished the last-minute touches, we'd invite our guests to enjoy desserts and drink in the back of the room. And the students will join you again in a few minutes. So let me ask the class of 217 to stand. And let's have a great round of applause as they file out.